Hey guys, welcome to my channel. If you're new to this channel, my name is Celia. If you're not new to this channel, hey guys again, thank you for supporting. Thank you for always being there. If you were there from the beginning, I'm almost a year and 6 months long. So basically, let's just get right into it. Yesterday I got a retie. Me and my loctician were talking about a couple of things because I ran into this other lady that wanted sister locks. And she's one of those people, kind of like me, like, you know, I don't really feel like doing my hair if I have a hairstyle, and I'm gonna try to keep it in as long as I want to. I think she has alopecia too. We were talking about alopecia, and you know, I have eczema. I also have trichotillomania. So I was just like, why not make a video talking about the different types of hair disorders you can get, you know, or you have prior to getting sister locks. I felt like this would be very helpful. I didn't really see that many videos out there like that I can kind of resonate with, but I thought, why not put a video out like that? I just want to put a disclaimer out there that I'm not a professional. I'm not a dermatologist. I'm not a therapist. The only medical profession that I have is in the dental field, but I do have experience with some of these hair disorders that I have, and I'm going to touch on the ones that I'm more familiar with commonly. When I gain more knowledge about other hair disorders and how they affect locks and what you can do about it, then I'll drop videos about that. But for now, I'm just going to talk about what I'm familiar with. If you have any questions, just put it down below in the comments, and I can probably ask a professional or do some research myself to kind of figure out, you know, some information about it, because this is very helpful information when it comes to people that are trying to get locks or that already have locks that are going through these type of issues. A little background. Just like, okay. No, not the, these are actually my curtains, but I'm gonna just twist this way. Quality change real quick, but I had to use my phone so I could go back and forth between my phone and talking on the camera. What I'm going to be talking about today is I did research on different types of alopecia, and I just picked out the main ones that people mainly deal with on a day-to-day basis. There's a whole bunch of alopecias that I didn't even know existed. I thought alopecia was alopecia until yesterday when I was talking to my loctician. But I'm going to be talking about 4 types of alopecia, and then I'm going to talk about trichotillomania, and then I'm going to talk about eczema. Before doing research and talking to my loctician about alopecia, I didn't really necessarily think that, you know, I had it, but there's different types of alopecia that people may resonate with. What I want to talk about is the alopecia areata. Everywhere, any type of hair follicle that's on your body, from the hair follicles on your arm to your eyebrows to your eyelashes to the hair on your head. And the difference between this alopecia compared to all the other ones is that it's an autoimmune disorder. So it's kind of like, you know how people have diabetes, type 1, type 2. There's the one that's because you're insulin, and then there's one that's kind of developed later on in life from you not eating correctly and not working out and taking care of yourself the best that you can. But this is the one that is developed internally, a disorder that can sometimes be passed on genetically. Basically, your immune system is attacking the growth of your own hair follicles that are growing on your head. So every time a new hair follicle grows, your immune system attacks it. It doesn't get the chance to grow, and it causes hair loss. If you have this type of alopecia and you're interested in getting locks, I would definitely talk to your loctician about it, and definitely like tell her what's going on, what type it is, and she's most likely going to tell you to see a specialist, and the specialist that you would see is a dermatologist. Depending on the severity of that disorder, that specific one, the alopecia areata, they'll tell you if it's okay if you could get locks, if you can get locks, what to do about it, as far as like if you need to take any prescription medications to help your immune system to stop attacking your hair follicle growth, or if you need to do any type of like go about your hairstyle a different way when it comes to getting your locks installed, or when it comes to maintaining your locks when you have them. I think a different type of alopecia that kind of branches off of the first alopecia that I was talking about is called diffuse alopecia areata. So instead of it just being an autoimmune disorder, it can kind of like, it's not like something that just happens all the time, every time your hair follicles just grow and they just get attacked. Instead, this could be triggered, the attacking of your hair follicles can be triggered by anything that changes suddenly in your life. So if you're like all of a sudden you're exposed to a lot of stress, or have any sudden hormonal changes. Say you develop a new medical condition and you start taking some type of medication. Sometimes side effects of the medication can cause this type of alopecia. Now, if you go through something like this, I would kind of like, what I tell my patients when it comes to dentistry, if they're experiencing something like different all of a sudden, I tell them to sit back and kind of reevaluate the series of events that happened in their life for the past month and kind of see what happened different. I might say like, you know, I did have a recent death in my family, or, you know, I did start taking this new medication, or I started this new birth control. These are the different things that can cause a drastic change in your body, that can cause not just any other changes in your body, but also in your hair. For this type of alopecia, you can either go to a dermatologist or you can go to your regular physician, because what they're going to do is they're going to try to pinpoint what change happened and what they can do to basically regulate your body again. So let's say it was a medication, maybe you need to switch medications and get to a better one that does help your body the way it's supposed to, but it has different components in that medication that won't give you as much side effects. Same thing as like hormonal changes. Hormonal changes, you can get medications to kind of balance out your hormones, but as far as like pregnancy and stuff like that, that's gonna branch into a different type of alopecia. Really control the hormone, you know, fluctuation when you're pregnant, because, you know, that's your baby. To stress, you know, maybe you can see a psychiatrist, or you can see a therapist, somebody that's gonna help you develop new habits to kind of tackle your stress, and that's gonna help you have less outbreaks of that type of alopecia. Going into getting locks, I would probably try to tackle that alopecia. If it's stress induced, try to find a way to manage that stress, or your not your hormones, because most likely it's pregnancy. Or if it's not pregnancy, it's a birth control. If it's a birth control, I would just get switched to a different type of birth control where you have a lower amount of, you can have the low dose, you know, estrogen birth control pills. Just kind of like figure out what works for you. So this next form of alopecia that I'm going to be talking about is called cicatricial. Yeah, I think it's cicatricial. It's called CCA, cicatricial alopecia. So this type of alopecia developed when the area where you are experiencing cicatricial alopecia has been severely damaged. So it's kind of like an external factor that causes the alopecia. It could be a burn, it could be severe scarring, anything in that category. Any damage that happens externally to your scalp that causes hair loss is called cicatricial alopecia. It can be caused by like a severe infection, you know, like this, or anything that was caused by any type of bacteria or fungus. Honestly, when you get this type of alopecia, you can't really go about it. You would have to seek the medical help to tend to whatever happened, whether it was a burn, whether it's an infection. You have to treat the infection, you got to treat the burn exactly how you would if you were or were not to have locks. You go about your business of like having locks, and you have to, after you treat the external force that causes that severe damage to the hair follicles, then I would go see a dermatologist and say, you know, is it okay if I continue on with my lock journey? Is it okay if I start my lock journey? Postpartum alopecia. A lot of doctors don't really consider this as like a severe type of alopecia. When you're pregnant, some ladies experience this, some ladies don't experience this, but when you're pregnant, you do experience a lot of hair growth because you're getting a surplus of vitamins to make sure that your baby is developing correctly, and also to make sure that you're nourished so that you're healthy before, during, and after you deliver your baby. All these nutrients that you're consuming are going to, you know, they're gonna help your body. You're gonna become more of a superhuman. You're gonna become stronger, you can become healthier, your hair's gonna grow faster, longer, thicker. You're gonna get all the benefits of it. After you deliver your baby, you know, sometimes people don't continue on with the vitamins and the nutrients. And also like that sudden change and not continuing on with the nutrients, the vitamins, or that excessive hair growth that you had before, you start to get a lot of shedding after the pregnancy. But you know, you have your normal shedding before you're pregnant, before the nutrients, and that's the normal amount of hair that you're used to losing, versus, you know, while you're pregnant, you growing all that hair after pregnancy, you're going to lose more hair than you normally would because you grew more hair than you normally did during the pregnancy. Not necessarily like too detrimental. Again, everybody's different, you know, everybody's baby, everybody has a different experience with their baby, what their baby does to them. I've seen babies create cavities and root canals in parents before, so everybody's different, but usually it's not too excessive, the hair loss, to where you have a huge bald spot or anything like that. And normally after the pregnancy, then you go back to the regular hair growth. You're back to your regular hair cycle of how it was before you were pregnant. If I was in that type of scenario, you know, I would just touch base with my loctician every time you come in for your retightening and stuff like that. If it's too severe, I'm pretty sure your loctician will tell you. If you have a really good loctician, she's gonna pay attention to your hair patterns and how it's going and kind of update you on it based off of what she sees, and then ask you questions. To kind of sum up the alopecia segment, alopecia doesn't really necessarily affect just like one part of your head. It can affect the crown of your head. It really depends on the individual. So it's not just like one specific area. You can have different patches on your head at the same time, developing different types of alopecia. But this next segment, I'm going to talk about trichotillomania. I kind of touched on trichotillomania when I was going over like the eyelash growth serum and stuff like that. But I have trichotillomania. For those of you who don't know what trichotillomania is, it's basically like a hair pulling disorder where you pick at your hair, and it doesn't really matter exactly what part of your hair it is. Sometimes my spot is right here. As you can see, it's thin out compared to like, you could definitely tell a difference because I got hair right here and I don't right here. But this is my spot that I usually pick at. And I also pick my eyelashes, I pick my eyebrows sometimes. Yeah, but I feel like, you know, trichotillomania, you have episodes with it. You're not picking your hair all the time. It depends on the person, what part of your body you're picking and what causes you to pick, but stress is my trigger. So stress will trigger me to start picking, and it's not like I intentionally, like I get stressed, I'm like, oh, let me go pick my hair and pluck my hairs out. I'm just like, if I'm stressed, I'll just, you know, I'll just kind of like reminisce a little bit and kind of, you know, touch my head a little bit if I'm thinking. Then I'll start picking. And then I don't know, for some reason when you start picking these follicles out, whether it's your eyelashes or your hair or anything like that, it feels good. And it feels like it releases some type of chemical in your body to make you feel better about what's going on, until after you pick so many hair and you see the bald spot, whether it's here. Sometimes I have like no eyelashes and I just feel guilty at the end. I personally went to a dermatologist because I thought I was going to go to a dermatologist because it had to do with hair and stuff like that, and she told me that I had to go to a therapist because trichotillomania, that's more of an internal psychological thing, so that's more stress related. So it's more so you have to control your stress habits and how you take out your stress. When I first started my Sisterlock journey, I didn't really have as many episodes of trichotillomania, so I didn't really talk to my loctician about it until recently. I did have an episode of trichotillomania, and she was just like, what happened over here? Because like I had no edges and the locks that she put in my edges were gone. She was just like, what? And I was just like, oh, well, I do have trichotillomania, and I did have an episode recently. So that's something that you might want to talk to your loctician about before you get started, so everything's kind of transparent. You know, she knows what's going on. She knows what could go on. She knows, because, you know, a lot was going on during that time where I did start picking at this again. I had locks over here. I even made a video about how I grew my hair back over here after getting the sister locks. And then I had a lot go on, and then this happened again. So going to a therapist does help. I did go to a therapist afterwards, and you know, they basically tell you, they show you how to develop new habits, and they also help you realize when it starts. That was my problem. Like, I wouldn't realize when it started until it was too late, when I would start picking until it was too late, because I would kind of like do it unconsciously. So she would tell me to think about the times where I started picking my scalp, what I was thinking about and what was going on in my life. And whenever that happens again, just go ahead and full force find another way to release that stress before you start picking your hair, because once you start picking your hair, it's kind of hard to stop doing it until there's nothing to pick anymore. So I bought stress balls. I started going to the gym a lot more, so I just signed up for Pilates today. I feel like Pilates is really good when it comes to, like, you know, working out and being relaxed and like, you know, stretching and all that. So Pilates is really good if you guys are interested in that. So on Trichotillomania, my last thing that I want to talk about is eczema. So I have eczema. But I don't really break out on my scalp until I think I did recently when I was talking about my scalp was irritated in that last hair video update. But yeah, so eczema, inflammation that can happen in your skin, all parts of your body, that causes dry, scaly, sometimes red. It looks like, you know, ringworms. When people get ringworms, it looks like that, but like it's not a ring, it's a patch, and it could be this small to this big and anywhere. Main signs that I experienced when I had eczema was itching, dryness, and irritation. And you can get eczema anywhere where you have skin, everywhere. Whenever I experience eczema, you know, everybody's different. Like I said, I usually experience eczema during the winter times when the air is more dry versus the summertime, everything is pretty moist. So when the air is more dry and it's the winter time, I switch lotions. So instead of using oils, I use Cetaphil, like a thicker type of cream lotion, so that my skin is more moisturized. But I just noticed, like, you know, ever since I started going on this journey, I'm not able to moisturize my scalp, moisturize my hair, so it's just dry. I asked my loctician about that, and she said to use the Sea Breeze, that alcohol solution. You're gonna dilute it with water, put it in a spray bottle a little bit, and just spray that area until it's better. I didn't end up having to go that far in order to address the issue. I kind of worked on my scalp and the moisture on my skin and my scalp from the inside out. So, you know, the MSM powder really helps support healthy hair follicles and gets you the vitamins that you need to have healthy hair and the healthy nails. Also, I started eating a lot of fatty acids, so you could get the fish oil pills, or you could just consume a lot of healthy foods that are high in omega-3s. Like I consume olive oil, extra virgin olive oil. I use that to cook all my foods. I eat a lot of salmon, avocados, so that's gonna really help, you know, moisturize your body from the inside out. Your hair follicles that are coming out, they're moisturized. And you know, it's so crazy because my hair isn't dry. Like, I haven't put moisture in my hair for so long, washed it and all of that, and it's still not dry. And I noticed, you know, when I change my diet, if I have one of those weeks or couple of months where I'm just not really eating well, you can kind of tell the change in your entire body. So after, you know, I start eating well again, I'm kind of like regulated again. But that concludes my video. I hope this was very helpful to anybody that may be going through or may have experience with any of these disorders, has symptoms of these disorders, and they need to figure out how to go about it. You know, my 1 year and 6 month anniversary is going to be next month, so stay tuned, you guys. Bye.